I will now turn the call over to Holly Standhart. You may begin.
Great. Thank you so much, Jason. Good morning, everybody, and thank you for being patient as we start our QPP office hours this morning. So again, my name is Holly Standhart, and we are going to be hosting the QPP office hours for the month of February. And so as we get started, we're going to provide some updates to you as well. And can I get the next slide advanced, please? Ooh, it looks like we're having some technical difficulties still. Thank you. Okay, so just to give you a little bit of a disclaimer, so the content that is provided in this presentation is based off of the latest information that we have by CMS, and as always, it is potentially subject to change. So we encourage all participants to review policies and also to take a look at specific statutes and regulations that apply to you and for interpretation and updates, because it really is not a cookie cutter information when it comes to a lot of these measures. So, and then just to kind of give you just a little bit of background, again, Lake Superior Quality Innovation Network, it is comprised of 3 states. We've got Medistar in Wisconsin, MPRO here in Michigan, and then also Stratus Health in Minnesota. And we do collaborate together to improve healthcare for Medicare consumers and to share best practices and maximize efficiencies. So I'm just going to give a couple of submission reminders as we are approaching the attestation deadlines and such. There are a few key things that you need to keep in mind. First, you'll be reporting for performance year 2017. So on January 2nd of this year, the Quality Payment Program attestation system had opened, and that actually can be found on the QPP-CMS.gov website. In the upper right-hand corner, there is a new feature that it has been added, and you'll notice we've got it circled on the slide. It says Sign In. That's where you're going to sign in to the QPP attestation portal, and you're going to use your EIDM credentials. Those EIDM credentials are your Enterprise Identity Data Management credentials that need to be set up prior to accessing the system. The system is very intuitive. It will allow you to sign up if you do not have an EIDM account available. And then once you're in that EIDM account, you will use your credentials, again, to log into the attestation system and to submit your quality, your improvement activities, your advancing care information over to CMS by the deadline. Keep in mind that the CMS web interface, that quality reporting submission began on January 22nd. The CMS web interface is a specific type of attestation that is for groups of 25 or more who have elected to report to CMS to their quality measures and such to CMS. And then again, the login button that is located at the top. Also, for reporting for 2017, we have another deadline you have to be aware of, the Merit-Based Incentive Payment System reporting deadline. This is if you're going to be reporting potentially your quality, your advancing care, and your improvement activities. That will close on March 31st. One of the questions we often get asked is there a submission button that is part of this process? There is not. Whatever data that you have on that attestation portal by March 31st will be what is going to be submitted. And you can go into the attestation portal multiple times to make changes if necessary. Also, too, the CMS web interface actually closes on March 16th. So it's a few days prior to the MIPS, the general attestation. And again, just to reiterate, the web interface is something that you would have had to have registered for. It is for groups of 25 or more. And if you have not registered for that, this is something that will not apply to you. Also, if you are in an alternative payment model, such as an ACO, you will have to work with them. An ACO is an accountable care organization. You will have to work with them to really get your information over who is going to be submitting your quality measures, which most likely it'll be your ACO, and then also whether or not who will be submitting your advancing care information, whether you're going to be doing it as a practice or a group, or if your agreement with your ACO includes attestation for advancing care information. Also, accessing the reporting portal as soon as possible. You don't want to wait until the last minute to submit your data over to CMS. Just for the simple fact is that you will have to go through multiple steps to get your EIDM account set up if you have not done so already. And just in case if there are any clinicians that are missing from the attestation portal, you will want to make sure to ensure that PACOS, the provider system where it houses all of your NPI information, is up to date, and that potentially could take anywhere from 24 up to 72 hours for a clinician to show up on the attestation portal if they're not listed. And again, we just cannot stress enough, do not wait until the last minute. So as part of the QPP office hours call, we also wanted just to kind of give you a high-level overview of the Year 2 final ruling for 2018. And there have been some changes to the quality payment program for this year. And again, we're just going to do some highlights. One of the first policy changes includes the low volume threshold. Previously, you were excluded from MIPS if you did not meet the $30,000 and the 100 Medicare patient minimum. For performance year 2, which is 2018, which started on January 1st, that threshold has changed, and that has to be $90,000 and more than 200 Medicare patients. You'll be excluded if either one of these criteria do not meet the $90,000 minimum threshold or the 200 patient count. Secondly, for 2018, one of the newest things that has become available is virtual groups. It was not available in 2017. However, the registration process did occur towards the final quarter of 2017 to participate as a virtual group in 2018. Virtual groups can be made up of solo practitioners and groups of 10 or fewer clinicians, and they would be submitting data to CMS. It's almost kind of like a group reporting, but you can have multiple clinicians at different locations and different tax ID numbers. We expect that the virtual groups for 2019 will open up sometime mid-year to the last quarter as well, so that information will be forthcoming. Also, another big change for 2018 is the scoring threshold for MIPS participants. So previously, quality for 2017 was at a 60% threshold, and for 2018, it has now changed to 50%. Where that 10% adjustment has taken place is in the cost category. So for 2018, 10% of your MIPS reporting will be allocated to cost. So that adjustment has occurred for 2018, and there's no change in the advancing care information or the improvement activities percentage threshold that your final score will be weighted on. Additionally, small practice bonus, this was not available for 2017. If you are in a small practice, which is considered 15 or fewer clinicians, you may have the potential to be able to add 5 bonus points to the final score of your MIPS measures. Also, I'd like to talk a little bit more about the performance threshold and payment adjustment years 1 and 2. So for 2017, the minimum performance threshold was set at 3 points, and this was really related to the QPP or the MIPS Pick Your Pace option. For 2018, that has now changed. The minimum point threshold is now 15 points, and the Pick Your Pace option has essentially gone away. So 15 points could equate to multiple quality measures or multiple improvement activities. So we encourage you to work with your quality improvement organization to determine where you best stand with your measures and what your scoring is going to be. Additionally, 70 points for exceptional performance. There is no change with that for 2018. One of the things that you need to keep in mind is if you score higher than 70 points out of your 100-point total, is that you have the opportunity as well, based on a sliding scale, you have an opportunity to potentially earn additional bonus money based on your performance as well. Also, payment adjustment for 2019, this was based off of your 2017 data, which we're still currently submitting over to CMS. You had the potential to either have a negative 4% or a positive 4% payment adjustment based on the adjustment factor. for performance year 2018, that has changed. That has now been raised to 5%, and this will affect your 2020 payments on your Medicare Part B. And then also, we'd like to note that additional payment adjustments for that exceptional performance start at 0.5% all the way up to 10%. And again, there is no change for that for 2018. So if you have scored higher than 70 points, there is that possibility, depending on that sliding scale, that you might see that 0.5% or up to 10% bonus. Also, performance period years 1 and 2, for quality, this is where the biggest change we're going to see. You had opportunities to submit data for under your pick your pace option for one patient for one measure. Now, starting on January 1st of 2018, it has moved from either just a simple one patient or to 90 days. It has now become a 12-month evaluation period. Advancing care information, it's still at a minimum of a 90-day reporting period, but again, you can report up to a year and anything in between. And then also for improvement activities, that is also set for 90 days, minimum of 90 days, depending on your improvement activity. And then cost is evaluated at 12 months. Also, CERT requirements for 2018, a couple of updates that have occurred. You can still use 2014 edition or 2015 edition of your Certified Electronic Health Record Technology, or CERT as it is called, and that can be applied for year 2. For practices and clinicians who strictly use just 2015 CERT, they have an opportunity to earn a 10% bonus on their total score. Also, there's no change to the base score requirements. So for 2014 version, you could potentially report on 4 base measures and then add on with your performance measures. For 2015 CERT edition, that is still set at 5 base measures, and then you would add on your performance measures as you feel necessary. Also for advanced APMs for year 2, they extended the 8% revenue-based standard for 2 additional years. So that means that basically there's an 8% revenue that a alternative payment model, or most likely an accountable care organization, would have to meet in order to participate as an advanced APM. Additionally, the qualified participant performance period still stays the same. And then also an all-payer combination option, which basically uses the calculation based on EC's participation in both an advanced APM and other advanced APMs, so they could potentially be private payer APMs. We're going to see that go live sometime at the beginning of 2019, but more information will be coming out towards the end of this year. And then also eligible clinicians who participate in advanced APMs, but they do not meet the QP, that's the qualified participant, or partial qualified participant thresholds, are subject to MIP scoring. So keep in mind that there's that potential that you will be analyzed on those individual categories based on the new scoring system. So resources and tools, just a couple of things I'd like to point out. If you do need any additional information, our Lake Superior Quality Innovation Network website is located at lsquin.org. And then also, if you want additional information on the Quality Payment Program changes for 2018, they can be found on the CMS website. It is considered the Year 2 Final Rule Fact Sheet. And then also, too, if you do have any questions related to Quality Payment Program, you can always go directly to the CMS Help Desk. And then, as always, you can always reach out to our organizations in your respective states, and we will provide guidance to you on reporting for 2017 and beyond. And then also, here's our contact information for each of the respective states as well. And just one thing I'd like to point out is our next Lake Superior Quality Innovation event, our QPP office hours, will be hosted on March 15th, and that will be at 12:30 Eastern, 11:30 Central. And now I would like to open up the lines for any questions that we have. So Jason, if you wouldn't mind opening the lines. Thank you very much.
Thank you. If you have a question, please press star then 1 on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. If you are using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you'd like to ask a question over the phone, please press star 1. Standing by for questions. Okay, we do have a couple questions coming in. We have Heather. Your line is open.
Hi. It's possible that in year 2 we will not make the 90,000 threshold or the 200 pure Medicare patients. We have a lot of Medicare Advantage. How will our reimbursement be structured at that point if we don't have to fulfill the requirements?
Hi, Heather. This is Holly. So a couple of questions. First, how many clinicians do you have within your clinic?
Just one.
Just one? Okay. One thing I'd like to point out is by early spring, CMS will update the NPI lookup tool, which is available on the qpp.cms.gov website based on clinicians' participation for 2018. Now, if you do not meet the minimum threshold requirements, typically there's no further action that is required. That will not affect your Medicare payments. Right now, we are still seeing it as a traditional and railroad claims that it would affect. So you basically would remain neutral. You would not lose any money on your claims, nor would you gain any money. So essentially, you're just remaining neutral. However, CMS does encourage, if you would like to still participate in the MIPS program, just to kind of get a feel for the program itself, you are more than welcome to. But again, you will not experience any payment adjustment if you voluntarily choose to participate.
Okay. Thank you.
You're welcome.
Thank you. And next we have Carol. Your line is open.
Okay, actually that was my question as well. We're a single-handed practice, so it's been answered. Thank you.
You're welcome. Thank you, Carol.
And once again, if you'd like to ask a question, please press star 1. Next we have, looks like Lee. Your line is open.
Okay, so Louise, is that right? Or is that?
Yes, your line is open.
Oh, okay. Sorry about that. I do have a question about Medicare patients in this reporting mix. Is there a minimum required? Someone was saying you needed 20 Medicare patients in order to report on a measure. Is that correct or not?
That is correct. You need to have a minimum caseload of 20 patients to report on a quality measure. If we're talking about the advancing care information, which is basically the replacement for the legacy meaningful use, if we're talking about base measures, certain measures only require 1 in the numerator. But for the quality measures, yes, there is a minimum of 20 patients in the case volume for it to be included.
Okay, so for instance, upper respiratory infection for children has no Medicare. We have no Medicare patients at all in that measure, so we can't use that measure?
It's, you know what, I might have to call upon my partners here to answer this a little bit more in detail, but typically if there is a opportunity to swap out that measure for quality, and can I please ask what is really your focus at your practice? Are you internal medicine and pediatrics?
We're a family practice, tribal.
Family practice. Okay. So typically CMS would want you to take a look at other measures if they are available to you to report. And I don't know if you plan on reporting via claims, if you plan on reporting registry or electronic health record, but sometimes you can actually swap out measures. CMS does allow for what is called, it used to be called the MAP process, the Measure Applicability Validation process. And if they determine that you could have reported other measures in lieu of something like this, for the upper respiratory for children, then they would choose it. They would basically make the suggestion that you should have reported additional measures. I'm assuming, are you going to be trying to apply for an upward payment adjustment, meaning that you would be reporting on the minimum quality measures and advancing care and improvement activities, or are you strictly just looking at, okay, because if that is the case, I mean, sometimes you do not have any patients in your denominator, and sometimes that's all that you have to be able to report on based on your reporting methodology. But typically when we work with a practice or a clinician, we all often make that recommendation. It's probably best to look at a different measure and look at the improvement side of it in case CMS does kick that out and say you really didn't have enough measures to submit data for.
Yeah, I know when we were submitting for PQRS, that we did, you know, they said that, so.
Okay.
Thank you.
You're welcome. Thank you.
Hey,
Thank you. And one. Oh,
yeah, this is Reed Haas at Stratus Health. I just wanted to add on to that answer that it's also helpful to know that you can go on the qpp.cms.gov website and kind of look at the whole palette of measures, and there's a way to kind of narrow that down by filters to look at specialty measure sets, so you can look at those that are applicable to family practice, et cetera. And then also the fact that when you submit that measured data, you can submit the minimum of 6 that are required, but you can also go above and beyond that and submit as many as you like, and CMS will score the top performing top 6 measures that you select, so you don't have to have any anxiety about, like, well, which one do I pick? We've got more, but I'm not sure what I'm doing the best on. There's also a MIPS estimator calculator that we have that's out there and available. We can probably put the link at some point during the session in it for that, so that you can kind of evaluate what you're doing. Also, your scoring methodology is a little bit different under the MIPS program, where it really depends on benchmarks that CMS has for those measures. And you may have heard in previous calls, if you've attended those, the approach to that, I won't go into detail, but basically how you submit them, which measures you choose is going to impact the scoring.
Reed, hi, this is Lori Antefel over in Wisconsin. I also wanted to mention, just came back from the quality conference, and you can actually, you know, if you're uploading that quality data into the portal, it will automatically calculate for you, you know, what that score would be as well. So that might be something interesting to do, which is something that could not be done before. So, you know, so that if you do have multiple different measures, more than the 6, you would be able to look at it and right in the portal itself, it would be picking the highest ones for you, and you could see that.
Yeah, exactly, Lori. And the other thing is, as mentioned earlier, Holly mentioned that you can upload data more than once and basically kind of play with it a little bit, kind of a sandbox environment, and then whatever you leave in there as of March 31st midnight, that's what CMS considers to be your final submission. And that was the comment related to that there isn't a submit or confirm or this is my final submission. It's just whatever you have in there. So you might want to try a few different measures, upload them, see how you're doing, and you may choose some different measures, and you can actually overwrite the previous uploads or entries that you did.
And I did, this is Lori once again, and I did put the MIPS estimator link, our website, right onto chat as well.
Thanks for doing that.
Mm-hmm.
Thank you.
Once again, if you have a question, please press star 1. And at the moment, we have no further audio questions.
Also, this is Holly again. I'd like to just point out we also have a evaluation, if you would be so kind to fill out the evaluation during this presentation. Just kind of give us some feedback as to how we did, and if you continue to like this format, and hopefully we're able to answer all of your questions and provide you the guidance that you need.
The other thing I might add while we're waiting for people to think about other questions is some FAQs that we had surrounding submissions between January 2nd and March 31st time frame. And one person had asked us, what happens if I have, these different improvement activities and they occur in different date ranges? Well, basically, you're only allowed to submit one start date and one end date for all those activities. So basically, you take your earliest start date of any activity that you've undertaken in 2017, and then the final date when you completed any of your activities, and they can range anywhere between those start and end dates. So you just have to put kind of min-max dates in there for your submission, just kind of an FYI.
And once again, for questions, please press star 1. And at the moment, we have no questions in the queue.
Thank you. One update that I would like to provide that was not included in this presentation that we also had learned at the quality conference that we were at is if you are choosing to submit quality measures via claims, your claims have to be submitted no later than March 1st of 2018. So a lot of people think, well, I still have, several days to get, my claims in. But if you want those claims to be evaluated for your 2017 performance year via claims reporting for your quality category, those have to be submitted over to CMS by March 1st.
And I might add on to that, this is Reed at Stratus Health again, that I did a call into the help desk there, the CMS help desk, which we have the number on one of the slides for, and asked about claims, and somebody had asked me, well, how do I know how I'm doing? What's my score for claims that I'm sending in? Do I need to log in anywhere? What do I do? So basically, if you're submitting claims, you actually, and that's all you're doing for 2017, you really wouldn't have to log in to the portal. You could just wait and find out what your performance score is. But you can proactively, if you've got that EIDM, Identity Management User ID and password, log into the submission portal, and CMS is kind of batch uploading those claims as they come in and scoring them accordingly. I don't know what the frequency is that they're doing that, if it's weekly or monthly. We didn't get to that level in the call I had with them, but it was good to know that as you submit the claims, they do get scored, uploaded, and you could view those on the website. And Holly or Lisa, did you have any insights or learn anything on that topic?
No, actually, I have not heard anything on that, Reed.
Okay.
And this is Lori, and I'm going to want to double check on this. I thought that there was that they had mentioned that there's a 60-day lookup on claims, and that those that were submitted, within the last, that within the last 60 days would be the ones, or up to the last 60 days would be the ones that would be that would be represented in that quality score.
So kind of a 60-day lag period once it's submitted
exactly.
And adjudicated and so forth. Yeah, that sounds like something we'd probably need to do a little bit of research on just to find out some of that detail. But the concept, I think, stands. Like, you would have the ability to see that. So if you do have claims that you're submitting, there is, of course, going to be that lag time, and then the window closes March 31st. So you may not be able to see, full detail there. And I'm not quite certain. I haven't heard what happens beyond March 31st as far as ability to log in and view and so forth. I would make the assumption that we can still do that. You just can't upload, or you won't see any, possibility for modifications or changes.
Thank you, Reed.
Another item while we're waiting here, I put in the chat box there a resource for the QPP resource library, and it's a little bit difficult sometimes for people that aren't familiar with that main website to navigate to where all these excellent resources are. So basically, if you are in front of your computer and you go to the main QPP.cms.gov website, at the very top there, you'll see the choices of MIPS, APMs, About, Sign In. If you click on the About, and they'll have a highlight in a little window there, Program Information. The second item down, Resource Library, you'd have to click on that. You come to yet another screen, and it says Resource Library in large, bold, blue letters, and then there's a small link for Resource Library to cms.gov, and you have to click on that. To save that navigation, that's why I put that in there for you, and it'll take you to kind of a secondary site. It doesn't have that same look and feel as QPP.cms.gov, but it has both 2017, 2018 resources. There's a nice Year 2 overview fact sheet if you wanted to kind of look at some of the detail that Holly was sharing at the beginning of our hour here together. So there's a lot of good stuff out there.
Well, once again, if you have a question, please press star 1. We did have Heather on the line. Your line is open.
Hi, Reed, this is Heather, and I did call the help desk today at cms.gov, and they, just to answer to that question about the claims submissions, they said that I would have to go into the EIDM account, which you had suggested, but also that it only keeps the data for so long. So I haven't had a chance to check yet to see whether our claims are in there, but they said it doesn't stay in there forever.
Yeah, and I appreciate you bringing that up. So we'll have to do a little legwork and figure out, to your point, how long they retain that data. So perhaps beyond this submission period ending March 31st, how long can we go in there and expect to view that? And what is that time frame? Maybe they clear the system out at some point. You know, for all practical purposes, we're just concerned about the next few months.
But he said it might not even be in there now because we started submitting in September.
Mm-hmm.
So, like I said, I haven't had a chance to go in and check it yet, but that's it's not very
That would be great,
reassuring.
Heather. If you participate in our next call and if you have a chance to go in there and you could share some feedback, that would be greatly appreciated.
I would do that. I have one more question, if that's okay.
Go right ahead.
As far as the improvement category, if we've done the testing with one measure, one patient, is it advisable to do the improvement activities as well, even though it's not required?
So it really depends on your strategy and perspective on this. So if you want to, you can certainly do that. The critical thing is having the minimum 3 points in the quality category, which is achieved by one quality for one Medicare beneficiary. You've kind of met that minimum required so-called test pace for the 2017 transition year. The next thing, and I know in our conversation, your practice is paper-based. So, you know, you have to think about the next threshold to get up to is really that 70 and above points to achieve kind of this extra bonus and higher level of, payment in 2019.
Right.
So it may not, you have to think about the effort involved and what's it going to take you. You can certainly report on it, but there are different avenues because there's required electronic reporting in which you may not qualify because of that paper-based claim. So Lori or Holly, I don't know if you have any perspective or insights that you might want to add to that.
Yeah, one of the things, I mean, you do make a great point, Reed, about how much effort and time. Sometimes, you know, it requires to put a lot of effort in place, and especially if you're trying to report for one measure that you really haven't embraced, you know, how much are you going to have to jump through hoops, essentially, to get that reported to CMS. But, you know, like one of the things that we often suggest to practices is that you always have that backup method. You never know, you know, if something just went wrong with the quality measure submission for the pick your pace option, So, I mean, I always recommend if it's easy enough for you to submit something over to CMS on an improvement activity in case there's a question on that quality measure to avoid the penalties, then by all means, I would say, yes, certainly, that probably, would be a good option to take.
Since I haven't looked at the improvement qualities before because we just did the test, where would I find the most recent information on that?
Sure. For 2017, the improvement activities are located on the qpp.cms.gov website. There is, under the MIPS category, it breaks it down. It's the very first block, and let me go back to that screen. There's MIPS, and then there's APMs, and then there's that sign-in. Under the MIPS, it'll tell you here all the quality measures. You could even go down to advancing care or the improvement activities.
Okay.
And for the improvement activities, there's about 90 plus. I think there's like 93 activities. I believe.
Yeah, that's correct.
I'm sorry.
Okay. That's okay.
And,
probably.
Yeah. And, a couple of ones that, you may really want to take a look at. I don't know if you do chronic care management in your practice. That is considered an activity. The automated prescription system, if you have one in your state, registering for one, that is considered an improvement activity. There's a lot of good ones.
Well, what if you have an existing one? I mean, that's not an improvement because we've been doing it since.
Yeah, well, sure. You don't necessarily have to select a new improvement activity. If there's something that really fits the bill per se, you can certainly select that and report on that through the station.
I wasn't clear with my question. I think that is an existing situation in our practice, and it has been for 5 years at least, is the electronic prescription. So that wouldn't be seen as an improvement, correct?
You can select the measure. You can say that you have registered for the improvement or for the prescription system, and then there's also another measure that you can say that we've actually queried the prescription system. So even though it's in place for several years prior to, you still have that potential to select that as an improvement activity.
Okay. Thank you.
Okay. Thanks.
Yeah, I think to that point, the label of that category, improvement activity, for some people, like our caller was saying, Heather, it's not really an improvement. It's something they've been doing, but CMS doesn't restrict you from using those activities that are current and ongoing and getting credit for those. They don't have to be an incremental improvement, I think is what she was getting at.
Yeah. Okay. Thank you.
And we did have an additional question from Lee. Your line is open.
Thank you. So could you speak about the Physician Compare website where all these sequins and everything are going to be available for the public to view? Do we have to do any kind of maintenance on that website? Because I looked at it, and some of the providers we are listed there, we don't know who they are.
Certainly. Lee, this is Holly from Michigan. So that was actually a question that we did pose at the quality conference. We wanted some more information on it. And unfortunately, both Physician Compare and CMS were really unable to answer it. I think right now it's still in the development stage. What we're gathering and what Physician Compare has indicated is that there is the potential for all categories to be reported on Physician Compare for all of the measures, potentially for all of the measures that you submit for evaluation. But one of the things I'd like to point out, on February 20th and February 21st, Physician Compare is actually going to have 2 webinars that are going to be talking about what's going to show up, the correlation between reporting MIPS and reporting what's going to show up on the Physician Compare website. But right now, they really couldn't give us any detailed information. We suspect that all of the clinicians that do show up, they will probably be maintaining that on the back end for you based off of what's in PACOS and what has shown up in the QPP attestation portal for all of your NPIs that are associated with your organization. But again, we really don't have any of those details.
Okay. Could you share the webinar information at all?
Yeah, certainly. I can try pulling that up here.
Thank you.
And another item about that physician compare, I had a call about that this morning, and I was online with CMS Help Desk, and we're going to have to clarify this, but I was asking what happens to that data for those that are voluntary and those that are mandatory, so those that are above the thresholds as an individual provider. I was told that that does indeed then flow to the physician compare website, but those who participate on a voluntary basis, or if their practice under that TIN is doing a group submission, and those that are, excluded or don't meet those thresholds or just being pulled into that group score, that those individuals wouldn't be reported on. But I kind of took that with a grain of salt, and I think we need to do some follow-up, especially as I just heard that we didn't have some definitive answers from the quality conference.
Absolutely. Thank you, Rita.
Yeah, that's interesting. So at this physician compare, if we report as a group, how are they going to break that down?
Exactly. So that's one of our to-do tasks. I think we'll have to take that offline and see if we can get some more direction or answers on that.
Thank you.
I was left wondering the same thing.
Thank you. And once again, if you have a question, please press star 1.
So maybe another just little ancillary thing I was thinking about as Holly did her initial presentation was that scoring in 2018 where we're going from 3 as a minimum threshold, where you can just do kind of that single quality measure, and that kind of gets you out of the negative payment adjustment for 2019. But when it goes up to 15, there's a little bit of nuance to that, and I kind of learned that there actually is a range of adjustments. So if you were to do absolutely nothing in 2018, of course you would have this now higher level 5 in 2020 rather than 4 in 2019 payment adjustment. But there is kind of a range there, and the way CMS words it is they say if the bottom 25% below 15 points will see that full adjustment. So basically if you're about at 3 points or below for 2018, you'll see that full negative 5% adjustment. If you're between 3 and 15, you're going to see some range of 0 to 5% negative adjustment. Of course, you don't want to be in that category, but it was interesting to learn that they kind of look at, what those performance scores are and make the percentage adjustment to your Medicare Part B payments based upon the range of 3 to 15. And because the program's budget neutral, they take those who are receiving the negative adjustments between 3 and 15 points and allocating that to the folks that are between 15 and 70, that higher threshold that was described earlier, where then we dip into an even larger $500 million bonus pool that gets distributed to the top performers in the program.
I also was able to find the Medicare Learning Network events that are coming up, and I just posted that over to the chat. And if you scroll down, once you access that link, once you scroll down a little bit, you can access the upcoming webinars for the Physician Compare. There's also some other webinars as well that attendees might be interested in. And one thing I would like to point out is that the Medicare Learning Network typically offers CE credits for participation in some of these webinars, so especially for your clinicians and support staff that are in need of continuing education units. There might be that opportunity to get those in addition to learning about quality payment program and other types of topics as well.
And we did have a question from Nicole. Your line is open.
Thank you. We are filing the quality measures via a QRDA file. And I'm just wondering, once we upload that file, is there a way to tell if Medicare rejects the file, or if we reach the March 31st date and it's rejected or something's wrong with it, is there an opportunity to refile? How does that process work?
That's a great question. Thank you for asking. So if you are submitting the QRDA file from your facility directly, the QPP website is been designed to be a little bit more intuitive, that it'll provide feedback as to where the problems are with your QRDA3 file. If it is a successful file, there will be a little icon that will show up at the top that I believe it's a trophy that'll light up, or it should give you some type of feedback that says, it's a good file. So if you have a vendor that is submitting a QRDA file on your behalf, they would be the ones that would be the recipient of that rejected file, or if that file is accepted. I've seen a couple of practices that I work with that have worked with a registry vendor that has submitted the QRDA file, and they did receive feedback from the vendor directly saying that it was a successful submission. But you won't see it because the vendor will be maintaining the EIDM file and going into the attestation portal to submit that data. So depending on who's submitting will depend on who will get flagged as to that feedback on that QRDA3.
Okay, yes, that'll actually be me, so.
Okay.
And I've attested for the ACI and the IA, and I did see that little trophy that you're talking about, so I was just a little worried about the file, so thank you.
Yeah, I'm almost certain that it does show up with the quality category, but I could be mistaken with that as well.
Yeah, I think you are on track with that. This is Reed again. And Nicole, I'm going to put a link in the chat box here for the resource library, and what might be helpful for you is to navigate to that. This is going to be the 2017 MIPS resources, that link there. And if you scroll down, you're going to see find resource by topic, and underneath that it says 2017. And then there's the second category down is data submission. And there's two fact sheets, although there's one data submission fact sheet dated 1/2/2018, and then another MIPS submission drop-in article. And then there's 3 videos below that. I would take a look at that first video, and it'll give you some screenshots. And there's somebody from CMS that did a nice narrative about how the portal works. And this will probably give you a little bit of a comfort level with what's going on in there. And what we were talking about here was there's a data validation process for the QRDA3 file. And basically it tells you, as I think Holly was describing there, that yes, it actually goes through. It confirmed that all the technical aspects of the file work properly, and then it instantly scores it, so you'll see that. But I think that video gives a nice narrative explanation of what's really going on, a little bit more than I provided here.
Okay. I appreciate that.
Sure.
And we did have one additional question. Could you please state your name and your question? If you entered yourself into the queue, your line is open. Okay, and we did have another question just come in from an unnamed line as well. Could you please state your name and your question?
This is Lori Hoover. Can you hear me?
Yes, hi.
Hi. Nice to finally hear your voice, Holly. We've emailed a lot, but that last link that you just put in there about the videos, when I'm clicking on those links, all the videos are giving errors. All the YouTube videos. I tried them last week and they were doing the same thing. So I don't know if it's just my computer or if those videos are really broken.
Yeah, I'll double check it on my end here, but I did have success. But if we have a minute or two before we wrap up here, I'll try that and try and get back to you before the end of the call.
Okay, thank you.
Thanks, Lori.
And once again, if you have a question, please press star 1. And we had Carol on the line. Your line is open.
Hello. Okay. What site do I go to set up an EID account?
Sure, Carol. What you're going to do, the best way to get there is if you go to the qpp.cms.gov website. Once you're there in the upper right-hand corner, just click Sign In. And there will be a screen on that attestation portal that'll say to sign in, you will need your EIDM credentials. If you don't have any credentials, the second blurb, you may have used these credentials in the past to log in. You can just click on, there's a blue link, it looks like it's a CMS Enterprise portal. And once you do that, it'll redirect you to the EIDM portal, and then you could either sign up for a new one or ask for a new password if you had already signed up for an EIDM account. It's the best and easiest way to get there.
Okay. Okay.
And then they do have a new user registration guide that is also on the EIDM account as well. It is very detailed, and a lot of times we get asked, what is the best role that I need to have in order to either submit data? That really depends on if you're submitting on behalf of a clinician or if the clinician is going to be submitting data for themselves. They could sign up for an individual account, but if you are going to be attesting on their behalf, both parties have to have an EIDM account, and the clinician that is allowing the end user to attest on their behalf has to give them the rights to be able to do so.
Okay, so I would be submitting under the physician, so he would need to attest that I am supposed to do that?
Yes, he's giving you the rights to be able to do so.
Okay. Okay.
Both parties have to have an EIDM account. And just a piece of advice, a little bit of warning, if you are setting up a new EIDM account, please don't be taken back by the questions that are going to be asked. They do go into quite detail, wanting to know, because you are accessing a federal system, they will want to know information like your Social Security number. They will also want information typically on your credit history as well. So if you have anything like through TransUnion or Equifax, you might have to allow them to give you access to it. Why they really are asking for that information, that could be a separate conversation, but a lot of people are taken back when they first sign up for the account because it does go into such detail information that they're asking. And I would recommend you'll need about at least a half an hour to 45 minutes to really fill it out, and don't get frustrated. It is a lengthy process, so.
Okay. All right. Well, thank you very much, Holly.
You're welcome.
All right.
Yeah, and to add to that, another resource that might be helpful, since we have the link already out in the chat box, is that resource library. It's kind of says cms.gov Medicare Quality Payment Program Resource Library 2017 resources, and I was describing that to a previous caller. If you go into that website and then go down to the Find Resource by Topic under 2017 General Information, the second item down, you'll see Enterprise Identity Management EIDM User Guide dated 2/7/2018, and that will help you kind of walk through the necessary steps. And one other follow-up item for, I believe, Lori Hoover, I did go in and tested out those links for the webinars on learning how to use the submission website, and those did work for me, so you might want to get some IT assistance with that, or if you go to those links and rather than clicking on them, right-click that, and I believe you can do a copy link, and then if you could paste that into an email and send it and try mailing it off to yourself for another computer, or mail it to a colleague, try it on their computer and see if you have any luck. You may have some restrictions within your network or something like that going on.
Thank you, and at the moment we have no questions in the queue.
Great. I would like just to highlight again that we do have that evaluation that is been posted to the presentation. So if you would be so kind to fill that out and provide some feedback to us. And also We would love to hear if there's any topics or anything that you would like for us to cover in future learning sessions. We'll certainly take that feedback as well.
And once again, if you have a question, please press star 1. We have no questions.
Thank you. Well, just as we wrap up, I'd just like to really just let everybody know that we appreciate your attendance in these events and really appreciate all the great questions that came our way. And as always, if you do have any additional questions that you think of, certainly feel free to reach out to each of us to hopefully we can get an answer for you. But I guess if there aren't any other questions, then I think we can wrap up this event.
All right. Thank you, everyone.
Great. Well, thank you. Okay,
Thank
everybody
you.
have a great afternoon.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating, and you may now disconnect.